Hi everyone, this is Kieran from Kieran 5 Personal Training. If you suffer from pain or discomfort in your upper back, shoulders or neck, then stay tuned. In this video, I'm going to explain to you the origin of your discomfort, how to alleviate it, and what you can do to keep it from coming back. Discomfort in the muscles of the upper back, neck and shoulders is caused by poor posture. Poor posture is usually as a result of sitting for long periods of time at your computer desk, compounded by things like texting on your phone, using your laptop, tablets, and even driving. Now all of this accumulates and contributes towards a condition known as upper cross syndrome. Upper cross syndrome refers to very specific adaptations to poor posture. When we're in our natural position, where the ears sit above the shoulders and the shoulders sit above our hips, the muscles in the back of the neck can support about 12 pounds of weight. Now, when it comes to poor posture, the head moves forward, the chin sticks out and the shoulders round. For each inch that the head moves forward, it applies an extra 10 pounds of pressure to the muscles in the back of the neck, causing them to become overactive. Now, as this progresses, it leads to chronic tightness in these muscles in the back of the neck, side of the neck, as well as the chest. In order for these muscles to be active and tight, it requires the opposing muscles to become relaxed. So what happens then is you get a lengthening and a weakening of the muscles in the front of the neck and the mid-back. It's these adaptations that compromise the health and integrity of the glenohumeral joint, specific spinal joints, and can account for localized pain in the mid-back, the neck, and the shoulders. Now, upper cross syndrome is also associated with headaches and mobility issues of the neck. So what can you do about upper cross syndrome? First thing you need to do is address your everyday postures. If you find yourself slumping over at your desk, it's simply time to notice these behaviours and change them. The second thing you need to do is bring relief to those tight muscles through stretching techniques. And the third and final piece of the puzzle is to strengthen those weak muscles. The first stretch I'd like you to try is a stretch for your trapezius muscle. So take your right hand, place it on your left shoulder, and just press that shoulder down slightly towards the ground. From there, you're going to take your right ear, you're going to move it towards your right shoulder. So take a deep breath in, and as you breathe out, enter into the stretch. When you hit resistance, just hold it there. You can take another deep breath in, and as you breathe out, you can increase the stretch if possible. If not, you just hold it. And you can hold each stretch for 3 to 5 breaths. So it's the exact same thing for the other side. Left hand on right shoulder, push that shoulder down towards the ground, and then bring your left ear towards your left shoulder. You hit that resistance, you stop, and then you go again. The second stretch I'd like you to try is a stretch for your levator scapula. So take your left hand and I want you to grab the bottom of your chair. Okay, so that should pull the shoulder down slightly. Now what you're going to do is take your right hand, place it on the base of your skull. I want you to look at a 45-degree angle to your right, and you're slowly going to move the chin down towards your right foot. Now do this slowly because again, it can be quite an intense stretch, especially if you're tight. So take a deep breath in, breathe out, and slowly move the chin down towards the right foot. When you hit that first bit of resistance, you can pause and then repeat. When you finish the stretch, just ease out nice and slowly. Okay, and you repeat on the opposite side. The third stretch I want you to try is a stretch for your pecs, okay, so your chest muscles. What I want you to do is interlock your fingers in behind your lower back. Okay, so I want those fingers to interlock with the palms of your hand against the lower back. Okay, from there I want you to bring the shoulders back and I want you to elevate the chest. Okay, so as you breathe in, I want you to lift that chest nice and high. And as you breathe out, maintain that chest position. This time, breathe in. As you breathe out, just pull those shoulders back slightly. Now what you can do to make that stretch a little bit tougher is you can push the palms of the hand into your lower back. Deep breath in, push the hands in, keep that chest nice and high. And 3 to 5 deep breaths and then release out slowly. I'm going to give you one exercise to help address those weak muscles in the mid-back. The muscles you're targeting are called your rhomboids and they sit in between the shoulder blades. The movement that's going to target them is if you start with your hands in front of you and then pull your elbows back level with the shoulders and then just squeeze the shoulder blades together gently. That will target the rhomboids. Okay, so you can do this with a resistance band. Wrap it around a banisters, a pole, whatever. Start with a split stance, so that means one leg in front, the other leg behind. Okay, start with the band about shoulder height. Elevate your chest. Okay, and what you're going to do is you're going to pull the shoulders back and you're going to pull those elbows back. Shoulder height and gently squeeze the shoulder blades together. Okay, so pull back, count for 2. 1, 2, control back. Pull, 1, 2, and back. So this 2-second pause at the concentric phase of the motion is going to help encourage strength to develop in those rhomboids. So if you do that 12 repetitions for 3 sets, it'll help strengthen up those muscles.